Hello and welcome to another Conversations with Dr. Westman. Today we're going to be chatting about atherosclerosis. Last week we spoke about cholesterol ratios, and today we're going to learn everything about atherosclerosis and the risks that it poses. We also have a special bonus for you today, brought to you by Dr. Westman, and it is a new guide, 8 ways a keto diet helps improve heart health. We'll tell you a little bit more about this at the end of today's episode. We'll also put a link for you in the description. So Eric, what exactly is atherosclerosis?
Atherosclerosis is the process of damage of the arteries that happen in people that lead to things like heart attacks, strokes, peripheral vascular disease, kidney failure, things like that, where the arteries get damaged and they might become blocked or scarred internally. You might think of it as it starts like a sunburn on the skin. There's a process that happens on the inside of the artery, and your body tries to fix it. The fixing of it sometimes leaves scars or filling in potholes, that sort of thing. It's not always a perfect fix. And it's that long-standing process of inflammation and repair that leads to the narrowing and then those problems we don't want to have, like heart attacks, strokes. It's still today in the Western world, or the modern world, the atherosclerosis is the major cause of mortality, meaning people not feeling well and death. So you don't want to have atherosclerosis if you can possibly avoid it.
Now, who is most at risk for atherosclerosis?
Yeah, so there is a strong family history or genetic component. So there's that old saying that you can change lots of things, but you can't change who your parents were. So, you want to see if you've had atherosclerosis, the history in your family of someone having a heart attack, someone having a stroke, especially if they've had those problems at an early age, meaning before the age of 55 or so. The earlier the damage, the more genetic or more hereditary it is. But there's a strong environmental component to the developing atherosclerosis too, meaning where you live, what you do, what you eat. These are all important factors too. So, but I would say you're dealt the genetics that predispose you and your family to atherosclerosis. For example, in my family, there's not a strong history of atherosclerosis. And when I look in my parents, grandparents, the one individual who did get atherosclerosis had diabetes. And so that's another. So diabetes is probably the strongest risk factor for developing atherosclerosis. And we all know that diabetes is a bad thing, but you don't want to just manage diabetes. You want to reverse it and fix it if at all possible. So then comes the other metabolic problems like high blood pressure. That's why we treat high blood pressure as internal medicine, family medicine specialists. Long-standing high blood pressure puts strain and stress on these pipes, basically the tubes, the arteries. And then in the bloodstream, the metabolic syndrome, which is the high triglyceride, low HDL situation, is also a predisposition for atherosclerosis. Then comes BMI or obesity. Overweight and obesity is a strong risk factor, and smoking is in there as well. So, and that is a modifiable risk factor. If you can't quit on your own, there are lots of drugs and nicotine products that can help you, even specialists that help you quit smoking. And way down at the bottom of all these things are those traditional things that doctors talk about today that really aren't all that impactful. So like the total cholesterol and LDL are really kind of minor players, but they're brought up as big issues because we have lots of medications that can treat them. And it's been such a focus of our internal medicine or just medicine cardiology field for so long. Most doctors don't understand that there are these other modifiable risk factors as well. Lifestyle change being probably the most important, and certainly if you have diabetes or pre-diabetes, you want to turn around, don't go down that pathway anymore. But then don't forget about the family history. I recall a family friend or a relative of mine who didn't have heart disease. He didn't have atherosclerosis, but he had a executive physical, as some the companies will do. They value the executives, so they do physical, and they recommended a treadmill test. The treadmill test showed there might be a heart problem, and then the next step after the treadmill test is a heart catheterization, where you actually put a contrast material or kind of a dye into the arteries. And he didn't have heart disease. He didn't have coronary disease. It was a false positive treadmill test. Those happen. And he was feeling well, didn't have any symptoms. But then they taught him and told him at the end of all of this that he needs to eat a low-fat diet to prevent heart disease that he didn't have. So our system is set up to think still one size fits all, especially for atherosclerosis, that the only thing that you can do is cut the fat out of the food. And to me, that's kind of like using a phone with a cord when we have smartphones today. We can do things a lot more easier, and we're not tethered to a cord for the phone anymore. And the smartphones do so much. So lifestyle is really the key where you want to be if you have family history or any of these risk factors for atherosclerosis, which is also known as arteriosclerosis, which is just the process that leads to narrowing of arteries and all these other health consequences.
Now, if hypertension, type 2 diabetes, and metabolic syndrome puts folks at a higher risk profile for atherosclerosis, is there a way to mitigate this risk profile?
Well, absolutely. In my clinic, I reverse and treat hypertension, diabetes, metabolic syndrome by using a keto diet, a low-carb keto diet. It's a simple approach. On one sheet of paper, follow these foods, and I can reverse and cure these problems. Cure meaning you don't have any problem. You don't have the high blood pressure or diabetes anymore, and you don't have any residual problem from it. Yes, you can actually cure these conditions, metabolic syndrome as well. So I use a potent lifestyle change. It's called real food, a keto diet. Other types of diets can do it as well. Medications can be used to help people lose weight and to reverse all of these conditions. And then down the street from my office, the bariatric surgeons, actually, they changed the name of their organization to the Metabolic and Bariatric Surgeons, because they fix diabetes too. It's just, for me, it's a little risky. I'm not a surgeon. I want to use something that doesn't have that much risk and cost up front. Changing the food is so simple and yet so powerful that you can actually reverse and fix hypertension, type 2 diabetes, and metabolic syndrome.
Now, a typical cholesterol test cannot determine atherosclerosis, correct?
Well, that's right. And there's a lot of confusion about a number in the blood, the one number of the LDL or the total cholesterol, the triglyceride, the HDL. That's kind of, we're working on this metaphor. Some people use kind of boats as these carrying cholesterol around, and we use the idea of cars and the road. Let's say the road is your artery, and you have a pothole in the road or a atherosclerotic damage to the artery. Knowing the number of cars going around, which is the lipoproteins, and cholesterol is being carried in these lipoproteins, doesn't tell you if there's a damage to the artery. So knowing your number or even cholesterol itself, it doesn't tell you anything about the arterial wall, whether you have damage or not. And the kind of like the predictive models that weathermen use, sometimes they're not right. And the whole medical field has bought into the idea of predictive models and like the weatherman to be able to tell you whether it's raining in your house. Yeah, that's just not that well, unless you live in an area where there's no rain ever. The weatherman's always right? But most of the time, these predictive models that doctors are using in the office just don't drill down to the individual level that you want as the individual worrying about your own health.
So how does one tell if they have atherosclerosis?
Well, remember, so atherosclerosis is damage to the arterial wall inside the artery. So taking a picture from the outside won't tell you. I mean, this would be like doing a home inspection by just knocking on the walls and seeing, you know, if the outside looks fine, or if you do an X-ray through the house, it doesn't tell you where the issue is. So the only way to really know is to get some sort of test that looks at the artery itself and is able to tell the difference between the inside and the outside of the artery. And there are some tests that are non-invasive, meaning you don't have to have a heart catheterization. So the heart catheterization would be the gold standard of how to know whether you have narrowing. The problem with that is the heart catheterization is costly, painful, and has a little bit of risk. Doctors only do it if they're really thinking that you're in a high risk category for atherosclerosis of the coronary arteries. So it's not typically done unless you're having symptoms. But you can get these ultrasound tests. Ultrasound is like the test used to look at babies when they're growing. So it's so safe that the obstetrician uses ultrasound to show the baby growing. You can get ultrasound of the arteries of the neck and the aorta, and the ultrasound isn't good enough yet to see the arteries of the heart. So, but you can see how well the heart squeezes, whether it is a good pump function. Then the other tests you can do that are non-invasive, meaning you don't have to have that heart catheterization. There's something called the coronary artery calcium score, which tells you if there's any calcium, which is part of the healing process for these arteries. I guess it would be like you're seeing if there are any potholes that have been filled on the road. That's what the calcium will tell you. But then the calcium doesn't tell you that you have it inside the artery or not. It just tells you that you have some there. So it doesn't tell you the narrowing. So we're really left in the dark for the figuring out that picture of the artery. But another very useful tool that doctors use is that treadmill test, even with a nuclear scan added onto it, where they have you exercise on a treadmill and they're monitoring the heart rhythm and the heart EKG to see if there's any possible lack of blood flow to the heart. And recently I had a discussion with someone who had coronary arteries that had calcium, but she'd never had a catheterization, so the narrowing wasn't known. So they put her on a treadmill test. She doesn't matter. Put her on a treadmill test with the nuclei test added on, and it was normal. So that if there was narrowing, it wasn't enough to make a blockage to cause any sort of low oxygen flow during the exercise that she did. And the amount of exercise on the treadmill was above or equal to the amount that she typically does in her life. So that's called a functional test. When you don't know the exact artery composition or the blockage, but you're doing a test to show that the function of the heart, the blood flow to the heart, is enough to allow you to do whatever you want to do. I'm thinking that those tests should be focused on more than just knowing whether there are blockages. These tests are in the purview, or how should I say, the domain of family doctors, internal medicines, and doctors and cardiologists. So not all doctors can prescribe a treadmill test or a heart catheterization, but or just about every doctor can prescribe the coronary artery calcium score, and that is one that requires a prescription because it has X-ray involved. It has a CT scan. The ultrasound, interestingly, in our area, you can sign up, and there are companies that come around and they'll do ultrasound tests because it's non-invasive and there's no radiation involved. No X-rays, you can do it without a doctor's order. So a lot of people will get their own ultrasound tests to see if they have atherosclerosis or not. Remember, not just relying on the weatherman to tell you whether it's raining here. You can actually have a test to determine your own artery composition, whether there's narrowing.
Last question. Is there any symptoms one would have for atherosclerosis?
Well, right, yeah, and symptoms usually occur at a late stage. So a symptom from atherosclerosis comes from the lack of oxygen, the lack of blood flow. Remember, our blood carries oxygen around, and if there is a narrowing and there's not enough to support that organ, that's where you get the kind of crushing chest pain of a heart attack. When we say chest pain, most people say it's not pain, it's a feeling of pressure, or an elephant sitting on my stomach. Another common heart attack or heart ischemia or lack of blood flow to the heart symptom is a jaw pain going down the left arm. That's fairly common, or feeling tightness in the chest. It's not just pain, it's chest tightness. So that's if there's not enough oxygen to the heart. The other main organ that needs oxygen constantly is the brain. And so if you have a lack of blood oxygen, lack of blood flow, a narrowing in the artery here, that can cause a transient ischemic attack or a stroke, which is just a numbness and tingling in the arms or legs, or difficulty talking. You might have drooling. And those are pretty catastrophic events. If you have a TIA or a stroke, you're unable to move one side of your body. It's very frightening. And so, these are paths that you don't want to go down. So if the doctor is starting to talk about, having you have pre-diabetes, diabetes, high blood pressure, metabolic syndrome, you want to get on top of it and make changes. Once you get symptoms like this, doctors will do heroic things, like with an artery in the heart, they'll put a stent, like a tube to open the artery, or might even do arterial artery bypass surgery, bringing veins to go around the arteries. I mean, these are, while it's very common to have it done, you don't want to have that done if at all possible, because it's just managing the atherosclerosis rather than turning it around and fixing it.
Eric, thank you so much. We really appreciate your words of wisdom today. That's all we have time for. Be sure to watch next week's episode. But before you leave, remember that we have a special guide for you, which is The Truth About Keto and Heart Health, brought to you by Dr. Westman. If you're worried about cardiovascular risk, this guide is definitely for you. Remember that we have an upcoming course starting on the 15th of November called End Your Cholesterol Confusion with Dr. Westman. If you'd like to learn more about this course, you can find us at adaptyourlifeacademy.com. Eric, thank you so much for your time. We look forward to catching up with you again next week. Thank you so much.
Thank you.
Take care.